So what I'd like to show is a couple of comparative statistics just to show you again that Europe cannot be seen as one kind of single block, if you will, or single, when you talk about the European market and going to Europe, that there's really significant variation between countries, both in spending and healthcare systems. This is the one interesting figure, remaining health years at age 65, and healthy life years, not just life years, but healthy life years, so in good condition across Europe at age 65 for females. And you see that there's quite some difference between countries like Norway, Sweden, compared to some of the new member states, Latvia, Estonia. And part of it is, I mean, just the population health characteristics, but part of it is healthcare system driven for sure as well. And you see, again, quite some variation from 5 years to roughly 15 years of life expectancy at age 65. Part of it is the kind of standard of care that still differs quite significantly. This chart doesn't talk about healthy life years, but life expectancy at birth. And this is actually a global chart. What you see here is a trend line that shows with more spending, which you have on the x-axis, usually life expectancy is higher, right? And so most of the European countries are actually somewhere here, depending on their spending. You have India down here, Russia, but you see that the US is not, in a very efficient way, apparently using its resources, right? So that's something that we all need to work on, I guess, going forward. Comparative data on number of hospital beds. Look at this difference, quite striking. Germany, roughly 800 or 850 per 100,000 population compared to the UK at roughly 350. What could drive this difference? What do you think? Partly, yeah, possibly, maybe more procedures that are done, but what happened up to 2005, 2006 in Germany, hospitals were reimbursed by length of stay. And so essentially, if you kept a patient 5 days longer, you got more revenue as a hospital, right? And so there was some pressure, attention actually to why not keep people to be safe, a little bit longer in the hospital, which was a trend very different to the US, where you try to get people out of the hospital because of the cost situation, right? Try to shorten length of stay. And so some of this kind of leftover in terms of overcapacity still exists and is around in Germany. But again, when you think of markets and you have an estimate based on the US market that you want to just transfer to the European market, it doesn't always work that way, right? When you think of potential beds, if you're selling hospital potential opportunities, hospital beds, for example, quite a difference. Average annual hospital inpatient acute care days, again, talks about this fact. Partly it's a difference in length of stay. And the US being down here at 0.7 compared to Germany, Switzerland, 1.7, 1.1 at 2007. That has changed a bit, but still, I mean, keep that in mind, right? It's quite a difference in length of stay. Average annual number of physician visits, German WIMPs, right? 7. Compared to 4 in the US. There are 2 slides that I found also interesting. This is the discharges per 100,000 population for musculoskeletal issues in connective tissue hospital stays. And you see again, Germany being up there. How about Austria and Switzerland? What do you think might contribute to that?
Outdoor activities.
Skiing, exactly. A lot of tourists actually traveling and skiing and actually being hospitalized there, right? So when you take the Swiss or Austrian population, right, this is probably one explanation, I guess. But again, compare that to some of the other countries like Italy down here. How about this one? The same chart, but for ischemic heart disease conditions. Quite interesting, I think. I mean, when you look at these new member countries, Bulgaria, Lithuania, part of it is probably that the patients don't get access to kind of high-end care on the pharma side, and therefore are hospitalized more for heart failure, for example, right? So all of these health system issues also factor into these numbers, right? And again, you see quite a stark difference between countries across Europe. More than double actually between Portugal, for example, and then Bulgaria. And this speaks actually to what I just mentioned, the fact that in new member states you have still a significantly higher number of patients that die because of cardiovascular issues, heart attacks and everything, probably because they don't get the care that they get in Western parts of Europe. So still also opportunities to really use technology in a better way to improve patient health. Couple of device statistics. Look at this MRI unit number per per million population actually, and CT per million population. And probably not so surprising. I mean, Japan is wide up there, but then the US following. But then when you look at the spectrum here of countries, many of them being European countries, compare, for example, the French 6 versus the US 25, right? Substantial difference. But what actually surprised me even more, in the US you could always say it's a lot of litigation, right? And people want to make sure with more diagnostics that they are covered, right? There's no liability issue. And it probably is true. I mean, a lot is driven by malpractice concerns and everything. But I was a little bit surprised and shocked almost when I looked at this statistic. Look at Greece, right? MRI and CT number of exams per year. And that was pre-financial crisis, but still, it probably has moved significantly down now, but still, I mean, that is quite surprising. And again, it talks to the understanding of markets that you really need to develop by technology and by really a lot of analysis in order to understand the real kind of drivers in certain markets. But compare, for example, Greece and the US values here to Ireland, right? 16 versus 90. Dramatic. This is a number of coronary angioplasties, so catheter interventions. Look at Germany, right? Even more, significantly more than the US. And compare Germany at roughly 550 per 100,000 population per year. Compare that to Sweden, maybe at 175, or Italy, 133, Ireland, 82. Do you think it's all explained by a more severe diseased population or severely diseased population? Probably not, right? A lot is actually driven when you look at the UK. I mentioned these guidelines that really drive a lot, and the UK having implemented very strict guidelines. They don't exist in Germany, so there's a lot of latitude for physicians to actually decide whether or not someone should get a catheter intervention or angioplasty. And so, I mean, from a marketing perspective, if you're a US company looking at markets, probably, and you're in coronary angioplasty, you probably would start with the German market, right? Part is also that physicians in Germany, I guess, adopt technology in that space quite more openly compared to some other countries. But part of it is also reimbursement driven or reimbursement explained. This is one of the last slides that I wanted to show here. This is hip replacements, also involving devices, hip technologies, I mean hip implants, and then knee replacements. And again, you have this situation of Germany even being before the US. Partly that's driven by a very freely available reimbursement, I would say, to date, but that again is changing. And you see these dynamics playing out in all European markets, that more and more they're going to be very strict evaluations of whether something is really clinically needed and actually worth for in terms of paying for technology. So it's not all driven by medical necessity. But again, talking about European market sizes, compare, for example, for knee replacements, compare Italy here at 100 to Germany at 213, more than 50% difference. However, when you look at overall, I mean, we've seen all these differences. This is a recent study of self-reported unmet need for medical examination and treatment. You see that in most European countries, it's below 1% of the population that thinks they don't get the care they need, which is a good sign in terms of public health. Only, again, in the new member states like Latvia, Romania, Bulgaria, there's still quite some, I would say, I mean, not ideal care or not enough access to care. And keep in mind the 13 or 15 euros spending on medical technology, for example, that's probably one of the factors that contributes to it. So in summary, European market is for medtech an important market. It's also, or the industry is not only an important industry for the US, but an important industry for the European Union in terms of innovation. And innovation is really needed to kind of tackle the problems that we've discussed in terms of an aging population, more chronic diseases. We have one regulatory system in Europe with the CE marking process. To date is still considered kind of easier to get through compared to the United States system. Mostly very sophisticated levels of care, with the exception of these new member states that we've seen and discussed. Rapidly growing elderly population, a lot of chronic disease where actually medical technology can do a great deal, right? So it's opportunities in light of the kind of cost situation that is becoming more challenging, but it remains therefore an interesting environment for innovation and future innovation. And then, as we've discussed, the regulatory system is one, on the US side, one of the major drivers that for the last couple of years at least has led companies to Europe